Okay, I'm gonna knock on the door. I'm going to perform hand hygiene. I'm going to let the patient know who I am. I'm gonna identify myself. I'm gonna check two identifying factors for the patient. I'm gonna let the patient know what we're gonna be doing, which is a head to toe assessment. I'm gonna go ahead and let him know that I'm gonna work from his head to his toes. If he has any questions, he can stop me along the way. I'm gonna go ahead and get a set of vitals. Everything is fine within normal limits. Okay, and then I'm going to start my assessment. I'm going to check the head. I'm gonna make sure that it is symmetrical on both sides. I'm gonna make sure that I'm looking for any lesions, any bumps, anything that seems abnormal. I'm going to go ahead and check in both ears, behind the ears. I wanna make sure there's no lesions, redness, sores. Inside the ears, I wanna make sure that it is clear, there's no drainage, no redness. I'm gonna ask if he has any hearing issues. I'm gonna go ahead and look at his eyes. I'm going to check for perla on both sides. I wanna make sure that his pupils are reactive to light. They're round, reactive. I'm going to do the 6 cardinals, which I'm gonna tell him to keep his head straight and just move his eyes only with the pen light. I'm gonna check his conjunctive area. I'm gonna look to see if there's any redness, any discharge, any discoloration, any pain. And then I'm gonna look into his nares. I'm gonna make sure that there is no deviated septum. I'm gonna make sure that there's no nodules or anything that is concerning. I'm going to check in the mouth area, the mucosa. I'm gonna make sure that everything is moist. There's no discoloration, any sores. I'm gonna ask him if he has any swallowing issues. I'm going to check the carotid on both sides. I'm going to go ahead and move down. I'm going to go ahead and listen to the mid-clavicle, 5th intercostal pulse. Okay, and then I'm gonna have him take normal breaths while I listen to his heart. And then I will listen in 10 spots. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to then go ahead and sit him up, and I'm going to listen to his breath sounds. There's 18 spots on the back. I'm gonna start away from me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Okay, everything's fine. Okay, then I'm gonna check his arms, his upper extremities. I'm going to make sure that the skin is smooth, moist. I wanna also listen or check the skin turgor by pinching with my 2 fingers. I'm going to listen for the apical pulse. Yep, everything's fine. I'm gonna move down. I'm going to listen for the radial pulse, both sides. I'm going to check his fingers. I'm gonna check for capillary refill, 3 seconds or less. I'm going to have him squeeze my fingers. That's it for right here. And then I'm going to let him know that I'm going to assess his bowel area. I'm gonna ask when his last bowel movement was, if he's had any pains, indigestion, okay. I'm gonna get my stethoscope out. I'm gonna start in the lower right quadrant, and I'm gonna move my way up, and then I'm gonna move over and down to the last quadrant. I'm gonna ask you to cough for me if there's any pain. And then I'm going to palpate. I'm going to check to see if it's soft, if it's firm, rigid, if there's any pain that he's expressing. And then I'm gonna move down. I'm gonna check his lower extremities. I'm gonna check his inner thighs. I'm going to check the popliteal pulse. I'm gonna move down to the pedial pulse. I'm going to check his heels to make sure there's no skin breakdown, feel. I'm going to check the capillary refill on this as well. I'm gonna have him push against my fingers and then, hands, and then pull against. I'm gonna ask if he has any pain. I wanna make sure that everything is strong, muscle-wise. I'm gonna cover him back up. I'm gonna ask if he has any additional questions. At this time, he doesn't. I'm going to go ahead and wash my hands, enter the vitals, and leave the room.